Thank you for joining us on Facebook. Today, our topic is medication and prescription awareness. I am Nicole Moccasin, the community health worker in Lincoln, Nebraska. And today we will be speaking with William Freiberg. He is our pharmacist at the LeRoy Health and Wellness Center. Thank you for joining us.
Thanks for having me.
All right. So, Will, can you tell us a little bit about yourself, where you're from, what tribe you're a part of?
Yeah, sure, of course. So I grew up in South Sioux City, Nebraska. My mom worked for the Indian Health Service for 26 years, so we moved quite a bit. Most of my life I was up in Rapid City, South Dakota. Graduated high school from there. Went to pharmacy school at South Dakota State University. Ended up going to school further for my master's in healthcare administration from Oklahoma State University here a couple years ago. For the last 10 years, I've worked for the Indian Health Service up in South Dakota, and then for the last 5 years, I was down in South Carolina. But yeah, thankful for the opportunity to come here, work for my tribe. I'm Ponca tribe of Nebraska, and been here since December.
Oh, well, nice. All right, so let's get into the questions about medications. Why is it important to follow the instructions on medication bottles?
Well, what I tell patients is, the instructions on your bottle are specifically tailored to you. Your prescriber or provider specifically chose this medication, those directions based off of your chronic disease states, your labs, the other medications you're on, if you've told them about any supplements or herbals, kind of everything together combined. That's why they specifically chose that medication, that dose, those directions. So it is important to take those medications as prescribed for that reason. It's also important to know that, not all medications, even if it's from a family member or a friend, will be specifically safe for them or vice versa. Really when it comes to medications, it's something that is a prescribed medication for a reason, because there is potential for harm to occur if not taken appropriately.
Okay, so who can I call and ask questions about my medication?
Well, I would say you could call anybody here in the clinic, but I think the pharmacy is a great first stop shop. You can always ask for me. My name is Will. But yeah, from a healthcare professional standpoint, pharmacists are very accessible. Usually you can get a hold of us by just giving us a call. You don't typically have to leave a message, or you can drop by the pharmacy and one of us can help you answer any questions that you have.
So what are some of the questions I should be asking my pharmacist?
Well, one question that I always tell patients to ask, especially if they don't know, is why am I taking a certain medication? If you don't know the reason, it's a good question to ask, just because you're gonna want to know why you're taking a certain medication. Another question would be is how and when you should be taking your medication. Some medications are better in the morning versus in the evening. Another thing that I try to tell patients is it's so important to have a up-to-date and accurate medication list available. That could be just at your home, especially if there's an emergency. It's important to bring that medication list to the hospital or the emergency room. So you can always ask us for that medication list as well.
Okay, so let's see. Does it matter what time of day I take my medications?
It definitely can. Some medications are best to taking at the same time every day. Some medications are best first thing in the morning. Others are ideal 30 minutes to an hour before you eat. So yeah, definitely important to take a medication, especially if it's specified on the prescription bottle at a certain time.
Okay. Which side effects are considered normal and which are not?
It really depends. I think if anything's causing you, difficulty in your quality of life or just your daily functions, that's something that's gonna, our pharmacist or your doctor is gonna want to know about. But yeah, if you ever have something that you think is out of the ordinary, that you are not comfortable with, it's important to reach out to us and let us know, and we can help determine if that's related to your medication or not.
Okay, so what should I do if I happen to miss a dose of medication?
Well, that depends. Some medication you'll want to just kind of take it as prescribed the next day. Others you may want to take immediately right after you remember. Typically, if it's a medication, it's especially if it's something high risk, you'll probably want to give us a call, let us know. A couple examples of that would be warfarin or your insulin, things like that. So any questions, always reach out to the pharmacist, Fred, LeRoy, or Ponca.
All right. So should I tell my doctor or pharmacist about herbal or traditional medicines that I use?
Absolutely. Yeah, tell us everything. A lot of the times herbals and traditional medicine doesn't typically interact with what we call Western medicine, but it's also going to be important for us to know, just because there is potential that it may interact, and then we can always update your profile to include some of that information if possible.
Okay, so as people get older, does the risk for medication, is there more side effects for them, or?
There definitely can be. As we get older, our bodies just respond different to everything. Even water intake. Especially for an elder, if they're dehydrated, they're gonna, that's gonna impact them more so than, say, one of us being dehydrated to a slight degree. So yeah, same thing with medications. It definitely can.
Okay, and also, how long can medication be used after their expiration dates?
That's a question that I typically say, if it's expired, you'll want to dispose of it properly. I would recommend not taking it. But typically medication is okay for a certain period of time after the expiration date, but we want to make sure that it's for sure safe. So I would say do not take any expired medications.
Okay, so with that being expired, what do we do with the unused or unwanted medications?
Well, I would definitely say dispose of them as soon as possible. I think it's important to get rid of all of your medication that may be unused or unwanted out of your household, just to prevent any potential misuse or accidental ingestion from a family member. There's quite a few pharmacies in the area that you can dispose of your medication safely and in a place where it doesn't get into our groundwater or lakes or streams. But yeah, a lot of retail pharmacies here in Omaha and Norfolk have pharmacies that will do take back programs. Also, a lot of police departments do as well. So yeah, if you ever have any questions about that, reach out to me and I can give you that list and print off the list or email that list to you of pharmacies or locations that take back medications near you.
So, what can I do to store my medication safely out of reach of children?
So this is something that I'm very passionate about. I think it's very important to be aware of the potential of harm when it comes to medications, even over-the-counter medications to children. I think the key is to make sure that it's out of reach and also out of sight of your child. I think the out of sight's also very important. I know I have young kids that really like to climb on things, so if they see something they want, they're gonna probably figure out a way to get it. But yeah, definitely out of sight, out of reach. Also, just educating your kids when they get to be a certain age that medications are unsafe for them just to grab and take for themselves. It should always be a grown-up that gives it to them or a parent. Also making sure that they don't correlate medication with candy. I think that's something that a lot of us parents, especially when your kiddo's sick, you just try to come up with a way for them to take their medication. But yeah, making sure that they don't think it's candy is also important. So whenever you have a sick kid, try to explain it in a different way, such as, taking this medication will make your ears feel better or make your fever go down, things like that.
Okay, so what should I do with used syringes and needles?
So that's another thing. You definitely don't ever want to reuse a needle or syringe. We have a couple options for that. We have you can always put them in a large plastic container and dispose of it. Here in Omaha, there's the under the sink facility that you can take those safely to. Also, sharps containers, we do provide those here at LeRoy. Especially if you know somebody or an elder that has a hard time disposing of them, let us know and we can help them. But yeah, really, sharps container or a large plastic container, such as like laundry detergent, things like that. You can put those in, take them to the under the sink program, or a lot of sanitation companies will allow you to throw them in the trash if you kind of follow their specific directions. And each sanitation company is a little different, so I'd recommend reaching out to them to verify. I know here in Omaha, the Omaha Solid Waste Program, they do allow kind of like as a secondary option to, after going to the under the sink, you can actually take those and just put them in your plastic container or sharps container and dispose of those in the trash. But they do prefer the under the sink facility as kind of the first line option. Up in Norfolk, I think it's specific directions. Just put in a small plastic container, like a week's worth, and then dispose of it in the trash.
Okay. So what service do the pharmacy provide at the Freiberg Health and Wellness?
We have a couple things. We're a pretty unique pharmacy. We offer some services that not all other pharmacies in the area provide. A couple things that we do offer is we have pill boxes or pill cutters for our elders. So if you know any elder or patient that is in need of some of those things or have a hard time with their med boxes, we do offer med boxes that are easily opened. Clinical services that we offer, we do offer tobacco cessation for anybody that wants to quit commercial tobacco. We also help your provider here at the clinic with your chronic disease management, especially if you're part of our remote patient monitoring or continuous glucose monitor programs. We will kind of in between your doctor visits help you adjust your medications, kind of with the provider's help in between the provider visit. If your blood pressure is really high or if your blood sugar is running high in between the visits.
Any more tips you would like to give our audience?
I would say if you ever have questions, concerns, or if you want to talk to somebody about your medications, I'm always available. We'll make sure to provide my phone number and email address to the link here, just so if you guys ever want to call and talk, you guys have my phone number and email address.
All right. Well, thank you.
Yeah, thank
William,
you
for joining us today, and thank you for joining us today for Facebook Live.